officials. Also, one or two of our members online. I know member Christopher Fry struggled to log in, but I hope we will get it right within the next 1 or 2, 3 minutes. But we do have a quorum, and I think we can make a start. Let me use the opportunity to welcome all of you at this meeting, and I hope it will be a wonderful one. And let me use the opportunity also to say to you, participate, do ever what you need to do. That is why we're here, to tear issues apart and to ask the necessary questions and that sort of thing. Let me ask the members first to say who they are and that sort of thing. I'm Dan Plato, and Gillian, can we start with you?
Good morning, Gillian Postman, a member of this committee.
Thank you. Member Barnes.
Good morning, Chair. Good morning, everyone. I am Ayanda Barnes.
Thank you.
Good morning, everyone. I'm member Bakubaku Force.
Thank you. Honourable Member.
Good morning, everyone. I'm Ashika Singh.
Thank you so much. Online, we pick him up, Honourable Fry, but then we miss him and that sort of thing, and I hope the system will come right for him to be linked up with us. He is really struggling. But Christopher Fry is with us and part of the meeting. Let me ask and say welcome to the Honourable Minister, the HOD, the two officials. Honourable Minister, can you do the same?
Good morning, Chairperson, honourable members, to the committee coordinator, the support staff, but also to indicate that I will be here for part of the session, Chair, and under the leadership of HOD Dr. MacDonald and my two colleagues there, they will assist in providing the necessary performance information that I think this session is all about. So I'll hand over to Dr. MacDonald. Thank you.
Thank you.
Good morning, Honourable Chairperson, Honourable Members, and thank you for inviting us this morning. My name is Robert MacDonald, Head of Department for Social Development.
Good morning, Honourable Chair, members. Marion Johnson, Chief Director for Business Planning and Strategy.
Morning, Honourable Members, Chair. Siam Niftaghdien, Business Planning and Monitoring.
Thank you so much. Just note the Minister will leave within the next 35 to 40 minutes. I don't see any members of the public online. I see Christopher Fry, there he is right now. Honourable Member Fry, can you hear us?
Yes, I can. Thank you, Chair. I apologize for being late, but it's Member Fry.
Thank you so much. We note your presence. I don't see any members of the public. On that note, then, let me use the opportunity to say once again to the officials, I'm not sure who's going to present, but as you can see from the agenda items, brief the committee on the quarterly reports of the Department of Social Development for the period April to June 2022, July, September 2022, October, December 2022. May I ask the members if you are okay with a ruling that we allow the department to present? And you make your notes, you write down your necessary questions and that sort of thing, and then after the presentations, we can ask our questions and give the necessary input. You happy with that? Thank you so much. Dr. MacDonald or Minister, I'm not sure who's going to do the intro, but you guys may start. Thank you.
Chair, without further ado, I'll hand over to HOD MacDonald. Thank you.
Thank you very much, Chairperson. We do have a presentation that is ready to be flighted. I think just a question of how we get it up on the screen. It was submitted to the Secretariat, so maybe if you don't mind, if you could flight it for us, then we will go through it. Thank you, Chair. There we go. So I'll hand over to Ms. Johnson and Ms. Niftaghdien.
The presentation is basically going to follow a format where we'll look at the introduction and thereafter look at each of the targets that the department actually worked on over the past 3 quarters. As an introduction, fundamentally our performance information just shows how we are doing against our budgets and against our outputs. It's provided because it also provides us and ensures that we are accountable and that we are transparent in terms of our performance and that interested parties can actually follow and check our performance. This provision is also, there are various legal and policy mandates that that require us to provide the performance information. For example, sections 92 and 133 of the South African Constitution, and then also sections of the Public Finance Management Act, as well as the Municipal Finance Management Act and Public Service Act. They all provide for control over public expenditure and also empower public sector managers to use resources more efficiently. Of importance is the government-wide monitoring and evaluation framework. This is located within the Office of the Presidency, the DPME, and they are sort of the custodian of all issues related to monitoring and evaluation of government service and services, and especially they are the custodian of non-financial information about government services. If we can go to the next slide, please. Based on the government-wide monitoring framework, the DPME has also set up a classification system with respect to target attainment. So fundamentally, if your performance is between 0 and 49%, the target is not considered to have been achieved. If it is between 50 and 99%, it is considered to be partially achieved. And only where your performance equals to or is greater than your target are you actually considered to have achieved your target. Where targets are not achieved or where they are partially achieved, the departments, and all departments do this, they will provide reasons for why they did not reach or achieve the target. And they will also record the corrective actions that would need to be taken in order to achieve this. For the financial year, which will end now in March 2023, the department has been collecting performance information against 53 targets. 37 of these targets are monitored quarterly and 16 are monitored on an annual basis. The next slide, please. Since this is more about quarterly performance than annual performance, Honourable Chair, I've just taken the liberty of listing the targets that we actually report on annually. There are targets within Programme 1. All of them are annual targets. There are 5 of them. In social welfare services, we have 1. In our programme Children and Families, we have 3. Restorative services 1, and development and research, we have 6 targets against which we report. Next slide, please. This slide just reflects a summary of our performance against the number of targets over the past 3 quarters. As you can, if you, on the left-hand side under targets, you'll see that the quarterly targets are highlighted in blue, and we've got the columns that speak to whether a target has been achieved, partially achieved, or not achieved. I've just highlighted the 3rd quarter because I think there would have been far too much colour involved if one had to actually sort of highlight all 3 quarters to date. But based on our current validated performance information, at the end of quarter 3, we have achieved 59% of our targets, partially achieved 35%, and did not achieve 5% of our targets. And that 5% fundamentally refers to two indicators and the targets attached thereto. although we achieved fewer targets in the third quarter. It's down from 68% in quarter one to 59% at the end of quarter three, with our highest achievement being quarter two, with 70%. Just generally, the target achievement for the older persons program, persons with disabilities sub-program, as well as the target looking at the creation of work opportunities in the poverty program. Unfortunately, we will only be able to achieve those targets if we have access to additional budget. To date, this has been not forthcoming, so we are foreseeing that this trend will then likely continue into the fourth quarter. Our children and families program saw a decrease in target achievement due to factors impacting on interventions to reunify children with their families or caregivers, limited capacity of NPOs to manage children with behaviour challenges, as well as non-completion of parent education programs. And with respect to our restorative services, our targets are dependent to a large extent on court referrals. This is just a summary. When we go through each of the sub-programs, we can expand a bit more on the achievement. We're going to start, Honourable Chair, with Program 2, Social Welfare Services. And yeah. So if we look at our services to older programs, which deals with residential care, community-based care, and assisted and independent living facilities, what we find is that we've needed to shift funds because of budget cuts from our community-based care and support services, which is primarily what we call service centres, to residential care, because we cannot compromise the existing frail care services that is subsidised through the department. This actually then had a knock-on effect in that the targets were set with a particular budget in mind, with the budget cuts and our need to shift funds around. So we're looking at a trend, the partial achievement of this also continuing into the fourth quarter. If we can go to the next slide, please. A similar situation is also we're going to find with respect to our services to persons with disabilities. We were envisaging an expansion of these services, but owing to, again, budget cuts and the need to shift funding around, we will also only partially achieved the targets there. And where there's an uptake of people, we actually take them up also in our own DSD residential services, and hence there was actually a target achievement on that side. If we can go to the next slide, please. The undue hardship social welfare services program, social relief. What we found during our first quarter is that if you look at the target was 254 for undue hardships, and our quarter one achievement was 216. This was actually quite well, it's not a curious anomaly, but fundamentally what was happening was that the clients were opting rather to go directly to SASSA for assessment as opposed to through the DSD offices, so that they could access the 350 Rand grant. However, this changed during quarters 2 and 3, where we see a phenomenal increase in the number of clients who actually came through the department services for undue hardships and also disasters. And one of sort of anecdotally, the issue is that the fact that we have seen this substantial increase in terms of clients using our services speaks directly to the sort of socio-economic conditions and under which our households in the Western Cape are living. And also, of course, with the increase in households that are assessed for disaster cases, This is also indicative of the fires that have been experienced in the various settlements during the period under review. If we can move to program 3. Here again, we've seen increases in terms of family reunification, and these are members who are in shelters for the homeless, and there are concerted efforts in these shelters to try and reunify the adult members in the shelters with their families, so that excuse me, because I mean it's imperative to try and have people living on the streets actually living and going back to their households. With respect to the whole issue of family preservation, what we are finding there, we partially achieved our target for the third quarter, but we overachieved in the first and second quarter. The third quarter is also, Honourable Chair, notoriously difficult because it involves also the holiday period. And lots of people are also making plans, and we see a drop, particularly in December, and that impacts on family participation in family preservation. We'll see it again when we look at the children being reunified with their families or caregivers. A lot of what's happening there as well is that there's drops. Amongst other is the fact that there's non-completion of programs, and the third quarter is notorious for that kind of thing taking place. If we can move on to the next slide, please. If we just look at the number of children reunified with their families or alternate caregivers, we see that this has also been quite a struggle for the department. And reunification, you need to have both the physical and psychosocial well-being of both the child and the caregiver needs to be at a stage and must be conducive to ensuring that the best interest of the child prevails. Often also here with the reunification, we find that parents are not ready because there's issues of homelessness, so that means they don't have the appropriate physical circumstances for the child to be reunified back into. Or alternatively, we're also finding that they often there's a substance abuse issue with respect to the parents, and they have then not completed the substance use disorder programs, and hence there cannot be a reunification between the child and the parents or caregivers. And also you need to have both children and parents or caregivers willing to reunify and willing to actually become the family unit again. With respect to our residential care, we find there also that there's been quite an important issue with respect to the take-up by, especially NPOs, child and youth care centres, of young people, especially young girls, with challenging behaviour. The NGOs, a lot of them don't have the capacity to deal with that kind of thing. So they've also negotiated with the department in terms of rather enabling them to admit younger children, and the children with challenging behaviour, we as the department normally take up. And so this is why also there hasn't been the target attainment with respect to that indicator. There's also issues around unfortunately, the administrative side, because there's also quite a process in terms of verifying the performance information that is provided to the department. So often the information is not provided timeously. And once it does come in, it is outside the quarter and we cannot change our quarterly reports. But what we do is a reconciliation that will be seen at the end of the reporting period in the annual report. If we can go to program 4, please. Okay, oops, I've got the wrong, yeah, here we are. The referral of children to diversion. The sentencing of children and the awaiting trial children. This is all the prerogative of the court. The court will decide whether to refer a child to a diversion program and of course sentencing and of course awaiting trial. A lot of the times with respect to the diversion, we're finding that there are children who for various reasons the court doesn't feel that it can actually place within a diversion program. For example, there are those who commit very serious offences and also reoffenders. So the court will then direct an option to another diversion if it sees fit. The partial achievement with respect to the awaiting trial children, we're looking at that a bit differently. You may think, but the target has been achieved or overachieved. But in actual fact, the way we're calculating this target or the achievement here is we're saying that we actually will achieve our target if we have less children who are awaiting trial. That's the target to actually be looking towards as opposed to more children awaiting trial. So that is why that is considered to be partially achieved, because we actually haven't gone below if you look at the target for the quarter was 150 children. So that's why we only partially achieved this one. We are still continuing to work very closely with the Department of Education in the Western Cape to be able to clarify the roles and responsibilities of social workers in terms of the DSD and education in order to gain access to schools. If we can move on to, the next one. Our victims of gender-based violence, I mean, we're reaching the targets with all 3 of these indicators. And it's a good sign in the sense that more and more women are understanding that there is support for them. There's more and more women are becoming to understand their rights. And that is why we're seeing these increases in people, and especially women, looking for support and accessing psychosocial support services. And also, the fact that we actually have more and more facilities available. We've got an additional 6 GBV shelters, bringing in total across the province 26 shelters. And we've also, over the past, I think, year and a half, there's been an increase in the number of social workers who sort of deal specifically with gender-based violence. So currently across the province and including NGOs, we have approximately 68 GBV specialist social workers. 26 of these are located or employed by the department. If we could move to substance abuse. It's our contention that the fact that we are achieving all our targets with respect to substance abuse is indicative of the need for these services, and also I think the recognition that by people that they do require support. And this is, I think, especially relevant with respect to aftercare, because what we're seeing, and it's encouraging that more and more clients are actually going to aftercare, because generally previously, once they leave the inpatient facilities or certain community-based facilities, treatment services rather, they tend to disappear. But I think that the fact that more and more are showing up for aftercare and reintegration also shows that people with substance use disorders are realizing the need to have support, to be able to maintain their sobriety in the sense of both with drug and alcohol addiction. If we can move to program 5. The department has fared very well with respect to the support provided to NPOs throughout the financial year. I think these figures are very much higher than the figures that we've reported here, because we've identified specific ways of actually how we need to deal with that. So in terms of capacity building provided to NGOs, we also have exceeded, we've doubled. I mean, the target is more than, our achievement is more than doubled with respect to the number of NPOs capacitated and those assisted with registration, excuse me. And likewise, with respect to the provision of subsidized meals, we've seen an increase there. The issue of work opportunities, this is also directly related to budget cuts, because the NPOs now struggle to pay the minimum stipend, and it's the minimum stipend that determines whether this is considered to be an EPWP work opportunity or not. So here again, we're looking at the fact that this trend is probably going to continue over the final quarter of the year. And another issue as well, which an administrative issue, there is an incredible amount of administration that is required with respect to these work opportunities. In that timesheets, etc., and contracts, etc., all need to be checked. But here again, often when the information doesn't come in during a particular quarter, we will reconcile at the end of the financial year. Oops. You can move to the next slide. Yes, sorry. Our youth skills development program, excuse me, also has mushroomed. There's always, young people continuously are seeking ways and means to upgrade their skills and competencies. And that's why we see sort of also the increase in number of young people wanting to access the services that are available to them. Our population program, this is something that is in-house, that we have total control over, and we are, of course, on the way here to meeting all our targets with respect to the demographic profiles that we are currently developing. Lastly, finally, Honourable Chair and members, in conclusion, what we do note is that there is a high demand for services delivered by the DST. And this is due for the most part because of the difficult socio-economic conditions under which our people live. Also, this part of this is also to do with the ability to actually access services. So even though there are concerns there, we find that DST services, there is a demand and people are wanting to access. With respect to our information on subsidized meals, we can see that we have provided a little more than 500 additional subsidized meals to the public. It's our current third quarter, I think, was 10,100 subsidized meals, which is 500 more than our target that we had. And also we've seen, as I've said, the increase in the number of households who are coming to us for undue hardship. Likewise, the number of GBV victims seeking support remains high. And this indicates that there needs to be there's a sustained need and demand for these services as people become more and more aware of the fact that they are entitled to it and that it actually does exist. A primary issue is that our transfer funding budgets have negatively affected our ability to meet demand in particular instances and have put pressure on our own services. The budget cuts does impact on targets, and especially as it relates to older persons and persons with disabilities and work opportunity creation. And also, with respect to our children in residential care, the reluctance of NPOs, which is completely understandable, to admit children with behavioural challenges is also of concern to us as it places additional pressure, and the DSD take up these children as needed, because we are mandated to do that. We will continue to engage with key stakeholders to enable service delivery. We will engage with the courts to promote diversion. We are in continued discussions with the Western Cape Education Department to be able to develop a process and a plan so that we can support the effective referral processes and pathways that are needed so that we ensure that our children and youth at risk are able to access services immediately, that there is not a delay in them being exposed to an intervention from our side. And we will also work with stakeholders to encourage the promotion of participation by clients in the completion of the family preservation and reunification programs. Thank you, Honourable Chair. And any questions?
Mrs. Johnson, thank you very much for that detailed presentation. Members, you had the 3 sets of presentations, and it's now down to you with your input. Maybe you just want to make a short contribution or you want to ask a question. Can I see any indications? The 3 ladies at the back first. Honourable Kasim, we'll start with you first. Thank you.
Thank you, Chair, and thank you for the presentation as well. Mine is going to be very brief with regards to informal settlements and gang-infested communities, and thank you for your report as well and your programs that you presented. Is there any intervention plans or programs on the amount of school dropouts and youth, specifically in gang-infested communities, to ensure there are positive and beneficial alternatives in these communities other than these youth joining gangs or opting to use and sell drugs, like, for example, on the Cape Flats, where we know places like Manenberg and Nova Park. So what intervention programs or plans are there for these communities? Also, on the same issue, what intervention plans are there to prioritize children or youth in these communities, and what intervention plans do you have in partnership with SAPS and also law enforcement to ensure that these kids are actually removed from gangs and to bring them back on track as usual kids to obviously complete the education? I also have questions on the homeless. What opportunities are there for the homeless once they are removed from the streets? Because we know that they are being removed and placed into shelters. And then also, what is the current status? Do you have a status or the amount of the current homeless people in the Western Cape? Was there an increase or was there a decrease? I'm sure you should have that report as well. And then why was there an increase and why was there a decrease in the amount of homeless people? Then my last question is with regards to informal settlements. In terms of informal settlements and farming areas, I see that you mentioned programs like victim support programs. We know that in informal settlements and farming areas, there are no police stations. So which means our victims don't have access to police stations or to report their cases. So in most cases, the gender-based violence or the rape cases are not reported, because even today, these farming areas and informal settlements are still fighting for simple services like mobile SAPS or law enforcement facilities. So what intervention plans is there to ensure that these farming areas and informal settlements also receive or have access to these supports services? Yeah, that will be it for now.
Thank you, Honourable Member. Honourable Barkofos, please.
Thank you very much, Chairperson. Chairperson, my first question is on the slide of targets. What measures are in place to prevent the missing of targets? On the slide of person with disability, I picked up that if you remember, I raised some concern about the lady from Ceres. I want to know how are the programs of the department intended at assisting people like Miss Bless from Ceres, who continues to live with disabled son in abandoned building, and what progress has been made to assist Miss Bless. And my second question is on slide 3 on the programs. Given the challenge of the homeless person, what is the government's view on the many bylaws that have criminalized homelessness in municipalities like City of Cape Town? And what is the government intervention? And the third question that I have is on the program for restoration service. Given the rise in drugs, substance abuse amongst youth with is the cause of many social ills in the province, what is being done to address this challenge, and how far are we in terms of implementing the master plan, the drug master plan in the province? And my last question is still on the children and families. I see that you showed us the numbers of the members that were reunited with their families, but I would like to know if this program is continuously, and how do you monitor the relationship between those families after you united them, and how do you assist them so that they cannot go back to the previous situation? And my last now, where is right? My last, as we all know, the GBV is a pandemic. I would like to know what plans do you have to ensure that you are minimizing this pandemic in our province, because really it's a concern for me. Every day women are killed. If they are not killed, they are raped. I would like to know about your plans to minimize this. And lastly, seeing that, okay, let me take this rather. Can you please elaborate, how do you capacitate the NPOs, and which criteria do you use to do so? And I want to know, how do they identify those NPOs need to be capacitated? Thank you very much.
Thank you, Honourable Member. The Honourable Member's last means there's another last one. Okay, actually, I just want to check. It's quite a couple of questions. Don't you want to deal with those two sets questions first, and then we can do the next round? Thank you.
Okay, thank you very much, Chairperson. So in response to the first question about interventions around school dropouts and alternatives to gangs, the department does have programs to assist with this. We do also work in conjunction with other departments and agencies of government. So our primary work that we do with children and youth is through the Child Protection Program. We have a whole area of service that is dedicated to children who are involved in risky behavior as well as in conflict with the law. So children that are picked up as being at risk of being involved in gangs or already involved in gangs are dealt with in terms of the Children's Act. So we have secure care facilities where children who are who've been arrested and sentenced or who are awaiting trial are placed, and also for children who have not necessarily been arrested, but they are exhibiting criminal tendencies or uncontrollable behavior, also placed in those facilities. We also run probation and diversion services for children who are in conflict with the law, and those are reported on in the performance information. And children and youth involved in those programs are then sent to diversion programs to avoid them going deeper into the criminal justice system by being incarcerated. I think the other aspect is that we do a lot of preventative work as well for children at risk through our RACIA community-based child and youth care worker program, which is rolled out in high-risk communities. And then also removing children who are at risk, especially younger children, in households where they're exposed to violence and neglect and abuse, to alternative care. And that process is done in terms of the Children's Act by the child protection social workers as well as the child protection NGOs. In terms of school dropouts, there is also partnerships with the Department of Education who have their own social workers who assist children at risk who are in the school system. And there is, together with that, school resource officers and other programs that are aimed at assisting with reducing absenteeism and school dropouts and truancy. I think, though, that there is, generally speaking, not enough services to reach the full need that there is out there. And we have to be upfront about that. We do make full use of the resources that we receive the funds for, but we are really battling at the moment. Our facilities are full. There's a waiting list for children that need to be placed at our facilities, and there is also a massive growth in the number of children that are being placed into the child protection system at the moment, and the child protection social workers are struggling to deal with the numbers. The other aspect as well is that we've then tried to mitigate that by getting more community-based carers, more social auxiliary workers to assist children in the communities as far as possible. And the plan for the new year is to further expand on those programs, as well as to look at expanding parenting programs and other forms of support for children who are at home where parents are struggling with their children. But it is an intersectoral program. We also work with the SAPs. They've got a program they're running at the moment called Sports is Your Future, that DSD and Cultural Affairs and Sports, Education and other departments are partnering with. And there is also programs being run by the Department of Cultural Affairs and Sports for young people at risk. So there are a lot of programs, but I think that the demand is so high. And also in some of the communities where gangsterism is very severely entrenched, it is very difficult for the social workers to get to the children, to work with the children. There are threats on their lives, and there's intimidation. So it's a very difficult space for the social workers to operate in as well. So I think the reality is that it's an uphill battle in some of the communities to actually get to the youth and to turn things around for them. But I think the integrated approach has been assisting us because we are also bringing in the other departments to multiply what we do and to increase the impact. So it's not all negative, but I think we do also have to be realistic about what we are facing at the moment. The population of the province has grown very sharply. The last 10 years, the population has grown by just under 2 million people. And we are definitely feeling that extra caseload. We haven't had a lot of additional staff to meet that extra number of people coming into our cases. or into our caseloads, and that's because of the budget disaster we're sitting with in the province and in the country overall. So I think we've got services. There is legislation that speaks to what we need to do for these young people and children, and we implement it to the best of our ability. But we will always be, I think, asking for more funds to try and make sure that we can meet the demand and do a proper job. Because the other challenging thing as well is that we do the interventions, but then new cases come along, and it's very difficult for the social workers to continue working long-term with these young people. And I think that's the intention of our community-based child and youth care worker program, to try and create a longer-term support system so that once these children have been assisted through the social work interventions, that they do still receive support. There are a lot of other initiatives as well. The drop-in centres in communities are there to assist children who need to come and get some local assistance with sanitation, food, or homework support and other things. There is the mod centres. There is also the youth cafes, and then we run substance abuse treatment for children and youth in this province as well, which we've put in some schools. I think, as far as I know, the only province running school-based drug treatment programs, and also running programs, substance abuse treatment programs in all of our secure care child and youth care centres. So those programs are also there to assist. In terms of the question about opportunities for the homeless once they are removed from the streets, as we mentioned in our presentation, we do provide reunification services for homeless adults. The department funds social worker posts at all of the shelters that we fund, who work with the homeless adults, trying to assist them. If they need to be linked with substance abuse treatment programs, then they do that. And then also the City of Cape Town runs EPWP programs for homeless adults who've come into shelters. They provide several hundred opportunities every year for homeless adults to get work in the EPWP to help them get back on their feet and start to earn some income. And we also partner with a big network of NGOs that do a lot of kind of rehabilitative and support work for homeless adults once they've come into shelters. But I think also there is a vast range of reasons why people are finding themselves on the streets. And in some instances as well, it is due to the fact that they don't have a house or a home and they can't afford one. Or alternatively, because they have mental health challenges, and that's where we need to then link them to the Department of Health psychiatric services, or alternatively substance abuse disorders. And some people are also do actually have a home, but they set up a space on the street because they can't afford to commute to their workplace. We're seeing that more and more where people are doing construction work in CBD areas, and they actually can't afford to travel, so they sleep rough so that they can be at their place of work. So it's not always a case of people needing to be put through a rehabilitation program as such. Sometimes it's a case that people are simply trying to get by as best they can. In terms of the numbers, we saw a sharp increase of people on the streets during COVID. There's no conclusive research on the exact number of people on the streets, although the NGOs have estimated the number at around 14,000 during COVID. We don't know how accurate that figure is, but they did also include people who were sleeping in vacant buildings and other things. So it also depends how you define this number. But the numbers as they stand now are still high. We don't know whether there's been a substantial decrease. We have increased the number of bed spaces in shelters for people, and those bed spaces have been taken up. So we have been able to reduce the number of people who have nowhere to go. in that sense, as have the municipalities have also been putting in resources to create shelter space. The City of Cape Town has done this, as well as some of the other municipalities like the Drakenstein and others. So we have at least expanded that, and the expansion is still underway to accommodate more people. In terms of informal settlements and the question around access to victim services for victims of GBV, and what are the intervention plans for these areas, where we have started rolling out various projects to increase access to shelter for victims of GBV, as well as access to support services. You will have noticed in the financial or non-financial data for the department that the number of shelters the department has established has been increasing steadily over the last few years of this term of office, so that there is more access in especially rural areas where we've been opening a number of shelters. In addition to that, we are piloting projects like the GBV Ambassadors Program that aims to create a group of neighborhood volunteers who are able to assist victims of GBV get to a Tutazela care center or get to a police station where they can get assistance. And then, of course, there has also been an expansion of the number of Tutazela care centers where victims can go, which are one-stop centers where they can open a criminal case as well as receive medical treatment and trauma counseling from social development. And that's a three-way partnership between health, the NPA and the Department of Social Development. But the access is still only partial at this stage. GBV and victim empowerment services are certainly not universally available yet in the province. There's been very rapid expansion, but if we look back 10 years, there was a fraction of the coverage that we've got now. But unlike child protection services, where there is legislation that obliges the state to provide those services everywhere, victim empowerment and GBV services were not yet universally required to be rolled out by law. That has or is in the process of changing with the introduction of the Victim Support Services Act.
Dealerships, because expensive cost of content becoming a mafia country, shows that people listening, because everybody wants to steal.
Please mute yourself. Thank you.
Thank you, Chair. Yeah, so the Victim Support Services Bill is in the final stages of being wrapped up as a piece of legislation, and that will create a lot more structure for these services in terms of government's roles and responsibilities and obligations. So we are hopeful that that is going to come with more resources so that we can further expand the reach of services for victims of gender-based violence. But I think also the police station access is something that we have been advocating for through the National Strategic Plan for GBV. In this province, we have an implementation plan, as do the SAPs, and one of the areas we are focusing on there is oversight through the Department of Community Safety in terms of the rollout and implementation of victim-friendly rooms at police stations, and DOCS, the Department of Community Safety, is driving that process in collaboration with the SAPs. In terms of the question from Honourable Member Baku Vos on the measures to prevent the missing of targets, I think the generally speaking, there are different types of targets. So some of our targets are more projections than targets, and we will use that to guide us in terms of where our resources are going based on what we know is likely to happen in the year. But when we look at some of our targets, they're not necessarily targets we want to always meet. Number of children placed in foster care is not something we necessarily want to do any more than we want to place children into secure care. So some of our targets are there because we do need to allocate resources, and we need to account for those resources by including it in our annual performance plan and in our annual report, so that the public and the members of the parliament are able to see how we're using our money. But they're not always targets that we're striving to meet, certainly not to the last number. But equally, there are some targets as well that are within our control that we do seek to meet. Those are targets where we are trying to do things and trying to reach a certain number of people, for example, with parenting programs or other things like that. So those targets are ones where if we see that the target is falling short during the course of the year, we then step in to say, okay, what do we need to do to make sure that we do meet our target for the year? And that is why we have the quarterly performance information coming in, and then we check where there are targets at risk of not being met, and we put in the necessary steps. What we often find as well is that there is sometimes a quarter where things go a bit slower, either because there's a holiday in between or something like that, and then usually the number is made up in the final quarter. So quite often the Christmas period or festive period, certain indicators will drop because there are not so many people available for programs and things like that. And then in the last quarter, the figures are compensated for. But there are also sometimes targets that we have to change because we're no longer doing something the way we were going to do it. So one of the targets, for example, that's not achieved in here was a proposed or planned intervention where we were to work directly with schools on safety of young people and referrals of young people from schools. That was the program or project that we developed before COVID-19 arrived. After COVID-19, we put in the COVID recovery plan where area-based teams are now being used to coordinate safety activities on the ground. So we are now working through the area-based teams instead of directly with the schools. So that indicator now is no longer in use, and we will then remove it from the APP because it's not a project that we actually are doing anymore. We're doing it differently. So we can't continue counting that because we're not implementing it that way. So those sometimes the indicators need to be adjusted as well so that we can reflect changes in the operations of the department. In terms of the question about Ms. Bless from Ceres, I would have to come back to the committee with update on that because I don't have the information with me right now. I think I'd have to check with my regional director for the Winelands just to see what is happening there. But I think in terms of the principle, the issue of persons with disability and accommodation for persons with disability, we are over and over again confronted with the fact that we don't have enough accommodation for adults, especially who have disabilities. But even for children, we are battling with sufficient accommodation in residential facilities. But for adults with disabilities, there is a huge shortage of residential spaces for adults with disabilities in this province and in this country. It's a huge problem. It's something that we are really struggling with because there are so many people who are in a dire situation who need help, and we just don't have a space for them. As much as we've tried to maximize the number of bed spaces and community-based programs to assist daycares and service centers for disabled persons, it isn't reaching the full need. And there's some people who just unfortunately, they need to be placed into residential care. And some of the old age homes are admitting people a bit under the age of 60 to try and help out, even though they don't have to or they probably shouldn't be, but they are doing it because for humanitarian reasons, but the need is just overwhelming. We do try to get people with disabilities placed. We put them on the waiting list, and we get them placed when we can. But most times it does take a long time to get an adult a space if they can't afford to pay. And that is the biggest thing. A disability grant is nowhere near enough to pay the costs of having someone in a private a disability home. The question on about the view of the department on municipalities and how they deal with homelessness. I think I don't think my understanding of the laws is that they are criminalizing homelessness per se. What they are doing is enforcing bylaws when it comes to the conduct of people in public. So if people build a structure or a tent on a piece of public land, then that's against the law. So the municipalities then have to deal with it. But of course, they have to balance that with the constitutional imperative on government to progressively realize people's rights to housing. So when people invade public land and government then embarks on a process of moving those people off that land, the courts are generally requiring that there is an alternative piece of accommodation for that person to be placed in as an emergency measure. So the municipalities work through the courts when they deal with that. And I think that the courts have erred on the side of people's rights quite heavily in terms of requiring municipalities and provincial and national governments to find alternative accommodation before they grant eviction orders. Having said that, also we do find that homeless adults are coming into conflict with the law enforcement authorities over other areas as well, particularly when it comes to things like substance abuse in public, or in terms of criminal behavior. So there is that aspect as well. And I think sometimes it is related to substance use disorder, sometimes it's related to psychiatric problems. And there again, I think the authorities have attempted to use the Mental Health Care Act and the substance abuse legislation to assist as they can. But I think where there has been allegations of mistreatment of people or violations of human rights by law enforcement agencies, those matters have been brought before the Human Rights Commission, and the Human Rights Commission has been quite vigilant in terms of overseeing those things. And I know that the SAPs as well as the local law enforcement authorities have been engaging the Human Rights Commission around these issues. They're also attending the Intergovernmental Forum that has been established around homelessness, where they have been giving feedback on the measures they've been taken to try and strengthen the understanding of their members around dealing with homelessness in a sensitive manner and in a manner that is respectful of human rights. And we also have been facilitating training for the SAPs and law enforcement around the Mental Health Care Act, as well as the Children's Act and the substance abuse legislation, so that they understand how they can deal better with cases where there are adults with mental health challenges that need to be assisted. So we are trying to support the law enforcement agencies with not adopt a overly severe approach, and to be able to be responsive to the reality of the homeless in terms of their human rights and in terms of their particular needs. But I think at the same time there is a need for the law to be upheld. I do think that it is justifiable for municipalities and the state to protect the public's right to have access to things like parks, amenities and public spaces, because if these spaces become occupied, then it does infringe on the public's access to public spaces, and it can become a safety problem as well for the general public. So there's a balancing of rights that has to be achieved. In terms of the question around substance abuse and how far the department is with implementing the National Drug Master Plan in the province, the provincial government has adopted an updated provincial drug master plan in response to the new National Drug Master Plan. And the province is at an advanced stage in terms of having local drug action committees functioning. We've got 18, I believe. It's out of 30 municipalities. Not all municipalities have decided to go with establishing these. We can't force them, but we have tried to support them and assist them with it. But the local drug action committees are functioning in the majority. And we are also continuing with all of the different preventative and responsive measures that are set out in the drug master plan in the province, including preventative services, aftercare, and reintegration, and all of the treatment programs that are contemplated in the plan. I think, though, that the other aspects do fall in other departments' areas too. So the legislation around liquor and other aspects fall outside of the Department of Social Development's work, but we do coordinate with departments in terms of the drug master plan and advocate and support the rollout of those objectives. I'm nearly there. It takes longer to answer questions and ask them. Then in terms of monitoring the relationship between united persons with families, homeless adults who've been reunited with their family, how do we monitor it to avoid relapse? The department doesn't have the capacity to do long-term monitoring of adults reunited with their families. We unfortunately we get them to the point of reuniting them, but the best thing we can do is try and get them enrolled in a suitable program that will continue to support them, whether it's in the form of EPWP work or it's in the form of linking them up with Narcotics Anonymous or Alcoholics Anonymous or whatever kind of support group or support program that we can link them to. That is what we try to do. But our social workers are not able to do ongoing monitoring of adults because it would take a lot more capacity than we have. Most of our capacity is dedicated to monitoring of children placed in foster care or alternative care. So that's where all of our resources are going in terms of monitoring and tracking of cases. We also don't keep a comprehensive case management database of adults in the same way as we do of children. So we do record the data on adults that we've assisted, and we do have case files on them, but it's not we don't have the same level of tracking and systems that we do for children, because children are the department's statutory responsibility when it comes to placing them into alternative care, whereas adults is an area where we assist, but we don't have rights over their freedom and over their information on an ongoing basis. In terms of GBV and the plans to address this problem in the province, I think I did speak briefly about it earlier on, and I think our plans are essentially structured around the National Strategic Plan for GBV that was adopted by the National Cabinet in 2021, and we have a provincial implementation plan for that NSP. As the NSP calls on us to do. We've been rolling that out for a year already, but now we are in the process of finalizing amendments to that implementation plan that are due to be at Cabinet on the 15th of this month for finalization. So the implementation plan is what guides us. The implementation plan is structured around the 5 pillars of the National Strategic Plan. And those 5 pillars are what would guide all the different departments in the province in terms of how they respond. So social development has a specific role to play in terms of providing shelters, trauma support and psychosocial support to victims of GBV, as well as driving GBV awareness. DSD also has a role in terms of assisting GBV victims getting back on their feet, and we work with a network of NGOs to do that. And at the same time, our MEC is the lead MEC for GBV in the province, as mandated by the Premier, and she oversees the rollout of the GBV implementation plan across departments, and all of the departments in the province have been very much on board and coming forward in terms of supporting the plan and doing their bit. Whether it's the Department of the Premier with the media campaigns, or whether it's health with the Tutuzela centres and so on. And to also add as well that the municipalities have come on board as well. We've mentioned the GBV Ambassador Program we started in partnership with Swartland. There was a number of mayors at that launch who are keen to do the same in their municipalities. So we're really starting to build a network of partners to address GBV. I think that the SAPS is also on board. They have their own GBV implementation plan, so we can't tell them what to do. They do have their own plan, but we've worked with them to coordinate and make sure that we are not tripping over each other and that we are on the same page. In terms of how do we capacitate NPOs? I think, as we've mentioned before in this committee, we do have a unit, which is the NGO Help Desk, that supports NGOs with capacitation, and our local offices also assist NGOs. So we identify them in various ways. Some of them walk in looking for help. Some of them come to First Thursday and ask for help. Some of them call our NGO Help Desk call center number and ask for help. Some of them are referred by our program officers who say, look, we've got a disabled home and they need help. They've got governance issues, and they refer them over to get help, or there's an ECD who needs help or whatever. So there's various ways that we identify them, but where the team identifies an NGO that really needs an intensive intervention, then they will add them to the list of the NGOs that are going to actually be taken through a more in-depth process. But we assist a lot of NGOs just with basic things like they need help with registration or renewal of registration, things like that. And often we can assist them quite quickly with those sorts of things. So yeah, I think that's the last one.
Minister?
Thank you, Chairperson and the honourable members. As I indicated, I do need to leave, so it's no disrespect to the committee, but I do just want to add that gender-based violence is not just about women. And so we've launched a program called Break the Cycle. It's a video that was commissioned, and it focuses on boys and men, because for too long the conversation has only been with women, and we need to engage boys and men. I will forward the link to the committee chairperson, but I must indicate that this program runs from, well, it started in February, where Premier and I launched it at FAMSA in Khayelitsha with a fatherhood program of about 50 men. And we are rolling it out across all government departments. But there is a need, if you are using the video, that it comes with a trigger warning, because it could create secondary trauma for any young child or man who might have been exposed to trauma in his childhood. And it generally goes that if you've been a victim of abuse when you were young, and in the video you will see it's a boy child sitting on the back seat whilst his mother's being verbally abused, he grows up and likely becomes a perpetrator. Not all of them might, but it talks to the issue of trauma, and our communities are soaked in trauma. So GBV is just one aspect of it, but I think it's important for all members of parliament to know that there are radio ads, there are outside billboards, and there is this video which we are rolling out. We have in fact done it at one of our child and youth care centres, and something like 32 of the boys came forward and said they would want to talk more after seeing the video. So I think we are now starting to drill down and start dealing with the real issues, rather than thinking men are just perpetrators and it's only women that get abused. So my wish before this term is over to open a shelter for men only, because there are men who are abused, and I think we can't be in denial around that. So it is an intersectoral and whole of government approach, but it's also a whole of society approach. Thank you, Chairperson. And on that note, I wish to say thank you for the opportunity. If I may be excused, and I'm certain Dr. MacDonald and the team will take us through the rest of the program.
Honourable Minister, thank you so much for your presence, and have a wonderful day. May I ask members, some of us were looking for coffee and the coffee was not ready. Let's break for 15 minutes and go and have a cup of coffee, and after 15 minutes come back. You want to finish? Are you? You always working. Yeah. The members want to break quickly. Let's break quickly. Beaufort.
He's asking if we are getting another bill.
Oh, okay. Okay, guys, honorable members, honorable officials, let's get started. Doctor, thank you very much for the first round of detailed answering. I think everybody was listening tentatively and understand the context of the answering pertaining to the questions they asked. We're very pleased about that. And may I ask Honorable Windvogel, please?
Thank you, Chairperson. Chairperson, I'm actually partially covered by the previous member and the HOD, but I have two points of clarity and I think one question. But let me first welcome and appreciate the fact that the department has put in place an internal control system to manage their performance. Then secondly, Chair, I just need to get my paper ready. The presenter mentioned about 26 shelters in the Western Cape. So I want to know where is this, where are they based? Because I have this feeling that we are neglecting the rural areas. And if you look at the figures, because of there's no such support systems in the rural areas, people are not coming out, they are sitting in this toxic environment of households because there's no supporting system. So I really want to know from the department in terms of those 26 shelters. And then secondly, Chair, the presenter also mentioned whenever targets was not reached, she will say partially achieved. I just want to check in terms of your social workers. Do you have enough social workers in your program or in the province? Because we pick up that wherever we do oversight, there's always a shortage of social workers. Then lastly, Chair, is the presenter also mentioned about engagements, involvement of NGOs, of stakeholders, Department of Education, but I didn't hear of mentioning the Department of Health and Wellness. So I just want to check out, do you also have that type of engagement with the Department of Health and Wellness? Because I think it's important that we have that governmental relations, yeah. So yeah, I think I will park there. Thanks, Chairperson.
Thank you, Honorable Bunce.
Thank you very much, Chair. And once again, good morning after a nice breakfast. Chair, I think my question is on, in fact, it's more clarity seeking. I've noticed here under Program 3, Children and Families, I must say, first of all, that I see on quarter 3, that 998, it shows that it's above the targets. You've done better than the target that you have set, which is 796. One must say that I'm welcoming it from my side because from observation made, I think Member Windvogel just lashed on it by saying, I know we are dealing with targets today, but my question would rather be that our targets, the reasons we are having these numbers, is it because of budget constraints? Because when you look at the reality outside there, our targets are not really addressing the need of what is outside. So that's why I want to be clarified. Do we put our targets based on what we are having, the budget in front of us, or how do we measure that? But I do see the improvement of 998, but in reality that there's so much more foster children that are roving around. And I think even on our oversight, we picked up on foster children being ill-treated and not being placed into homes. So I want to know, is it a budget-related matter, or how do we get to that target of that number that is here, which I personally think that it's not really reflecting on the number of children that are not placed. And then my second one will be on Program 2. Program 2, Social Welfare Services. When one looks at the target numbers are the same for quarter 1, 2, and 3. And then if you look at the achievements and match the two, I must say the targets, you can almost say they are 90% reached. However, my question here on this specific program would be, if we place our targets, are we continuously funding the same NGOs because the numbers are constantly the same, Chair? So if we are saying we are having this 1674, so for the whole year we are just finding this 1674, and let's say for the following year, are we just funding a certain particular NGO? Who or where to does this funding go to? If I can get an elaboration on that one as well. My last one, Chair, I think when I entered, I went out for a minute. If I ask a question that was already asked, I must also be excused for that. I think HOD was speaking, or the minister rather, on the need of youth cafes. I think in our last engagement on youth cafes, there was one that was supposed to be open. I'm not sure if it was Cedarburg or somewhere in the West Coast, I'm not sure, or Overberg. What I want to know is, has that happened? Because we are speaking now about the youth cafes. And if we are still opening youth cafes, where are we opening? And also, how does the target for youth cafes work? And how do you make a decision where the youth cafe is supposed to be placed? How do you measure that decision? If I can just get a feeling on that one. Thank you very much, Chair.
Thank you so much. Honourable HOD.
Thank you very much, Chairperson. So the first question about the 26 shelters in the Western Cape and the location of those, we can provide those to the committee. I wouldn't want to read through 26 sites, but we can give you the list. Some of the shelters, we don't provide the street address because we don't want people to know exactly where they are, for the reason that we're trying to protect the people who go there. But there are a lot in the rural areas, and we've been particularly focusing on getting more shelters opened in the rural areas. So the 6 additional properties that we got from National Public Works that we operationalized during the COVID lockdown, those are all in rural areas. And we've also now been focusing on getting additional spaces up and running in Overberg. Yeah, there's definitely a focus on the rural areas, because we do recognize the situation is quite bad, particularly on farms and so on. A lot of the challenges we come across with the farms is that the women who want to leave those homes, they battle because they don't have an income, and the house is owned by the man. And so they go back every time because there's nowhere for them and their children to go. So we know there's a big problem on the farms, and part of the programs in the shelters is to try and help these victims of GBV and domestic violence to get themselves into some kind of transitional accommodation and get them independent as possible. But it's yeah, we still need a lot more in the rural areas because of the distances involved, and we are now looking at some additional sites outside the metro to assist. So we are definitely in agreement that there's a need for more shelter space in rural areas, and so we've been focusing on that. In terms of the targets and the issue of do we have enough social workers? The answer is we don't. Our population to social worker ratio is slipping because we haven't had a review of our organizational structure since 2010, and the population, as I mentioned earlier, has grown by 2 million people since 2010, and so we should be having quite a large number of extra social workers, but the budget situation is prohibiting us from expanding our establishment at this point in time, because it's not only about adding posts, it's also about adding office space and more GG vehicles and everything else, tools of the trade and computers and everything else. And then also you need to have more supervisors to supervise the extra social workers. So we have been able to do various things to try and help the situation. Like we got some extra money for GBV social workers, that was helpful. We got extra money for social work graduates, that also helped. But we're kind of reaching the limit of what we can do with that, because now we've got some supervisors with far too many social workers. And we need more social work supervisors to be able to manage the people we did get. But having said that, we did get some extra money from Treasury during the adjustment budget to fill some of our, at least to fill some of our posts that are on the establishment, and Treasury has given us a bit more now for the new financial year starting 1 April, where we've got funds to fill 240 social service professional posts. So that would be inclusive of social workers as well as child and youth care workers and social auxiliary workers. So we're going to use those funds to fill as many posts as we can, and also where we can bring in extra social work graduates to assist in the local offices. We're doing so as far as we can, bearing in mind sometimes we don't have office space to get as many as we'd like to get. That's why we've resorted to some measures like trying to get spaces from municipalities so some of our people can sit there, or spaces from partnerships with other departments and other NGOs where they've created space for our people to sit on a temporary basis so that they can reach communities. So it's quite a difficult situation for our social workers. Their caseloads are getting very high and they are battling. At the same time, the NGOs are battling too. Because also the funds we give them for social work posts, they're struggling to fill those posts because a lot of the social workers now aren't willing to work for the salaries that they can offer, so they're not able to fill their social worker posts very easily. And a lot of social workers now going overseas because they can earn better salaries in the UK or Australia or Canada or New Zealand. So we have a big problem with social workers being taken up by other countries as well. The question about the Department of Health and do we have a working relationship with the Department of Health? Yes, we do. One of the things, for example, is we've got a 3-way agreement signed between Health, Education and DSD around support for learners at schools with various things like their well-being and safety. We do also have partnerships with health on a number of things, like the treatment for substance abuse for people who have co-occurring addiction and psychiatric disorders. We also do work with health around children with psychiatric disorders, particularly child and youth care centre clients who need assistance with psychiatric services. And we also are working with health on with children with disabilities, where they assist us with certain services for children that are in the NGOs and so on. So we do have a lot of things where we work with health. The Tutuzela Care Centres, as I mentioned, is also a partnership with health. And then health is part of the GVV implementation plan in terms of having a number of roles that they play. And then also we work with them in the child protection system because they do screenings of the children who are brought in to be placed in safety care and so on. So yeah, we have a lot of overlap with health in terms of the work we do. In terms of the question from Honourable Member Barnes on the targets that we set versus the need, you are correct. We are certainly not able to set targets as high as we would want to. If we had more budget, we would set our targets high. I think though on the foster children, we are obliged in law to assist every child that's in need of care and protection. So there we make sure that whatever we have to do, we make sure we prioritize that. So in terms of setting targets around foster placement for children, that is something where there's no room for negotiation. We have to fulfill that role. The courts force us to, because the courts are the ones that place the children, and we have to work with the courts for that process. So yeah, I mean, so those are newly placed children, but we do have 39,000 children in foster care already in the province. So what you see there is the target only speaking to newly placed children. As I mentioned, we'd prefer not to be exceeding our target because actually, ideally, you don't want to have lots of children in foster care. But when the parents die or, the parents are missing whatever, there's nothing we can do. We have to put the children into foster care. So unfortunately, we've been seeing a big increase in the number of children going into foster care this year. We started out the year with about 35,000 children in foster care. We're now at 39,000 children in foster care. And that's one of the things that's putting a lot of pressure on the social workers as well, because that's quite a big jump in terms of their caseloads, especially in certain areas of the province. So the difficulty, of course, that we're sitting with as well with the foster care system is that we also have to extend those foster care orders every 2 years. And that's where we're sitting with some backlogs at the moment. I think our backlog is around 2,000 at the moment of cases that need to be extended. And that is always a bit of a tricky one because the social workers need to go back to court again. They need to get the extension order. So that is a bit of a slow process. They've got to find a court date. And then sometimes the court hearing happens, but then they have to wait again for a while before they actually get the order. Because the court doesn't necessarily give them the order on the day that they're in the court. So there's an administrative process that is also can be quite onerous. But if there are children who should be in foster care who are not in foster care, then that is a question of them needing to be those cases needing to be reported to the department so that we can then get the social workers to start investigating the circumstances of those children. Also, if there's children mistreated in foster care, that's a different issue that again needs an intervention by the social workers to deal with that foster parent and remove the children from that foster parent and make sure that there's no more children placed with a foster parent who abuses children because they're there to protect them, not abuse them. So it's that target we base more on projections of what we're expecting to deal with for the year. It's not really a target that we are limiting ourselves to or that we are trying to meet. But the foster system is changing now as well because of the amendments to the Children's Act. So what's happening now is children that are placed in the care of family members are no longer going to be placed into foster care. They're going to be placed as children who are in kinship care, and those children will receive child support top-up grants. So this was an amendment to the Children's Act that was introduced in the National Assembly together with amendments to the Social Assistance Act. And the intention is essentially to reduce the number of children who are in the foster care system to those children who are placed because they are in need of care and protection, rather than children who are placed with uncles, aunts, grandparents, or other family members because their parents have an arrangement with them. And that means now that the number of matters coming before the courts is slowly going to reduce to focus just on the children that are actually being abused, neglected, or in need of special care. And the other family-based placements are now dealt with without going through the court. So that's a different thing that is going to start coming. It's being phased in from this year. But it will affect the numbers as well. But in terms of the general principle that Honourable Member Barnes has raised, it is correct. A lot of our targets are not high enough to meet the need, particularly in terms of things like disabilities, in terms of older persons, in terms of homelessness, in terms of the victim empowerment and GBV services. Most of this we are not meeting the need, not by a long shot. With children, also, we're not necessarily meeting the need in terms of preventative services and services to families where we need to be helping prevent children slipping through the cracks or helping children to get back into school if they are missing school or dropping out. Those things we are not getting to all of those cases. But with foster care placements, we generally get to most of them because we have to. In terms of the question from Honourable Member Barnes about the targets for disabilities and the question of the target of 1674 staying the same through the year. That's the number of bed spaces we're funding. So through the year, normally what happens, we have a 3-year funding cycle. Every 3 years we advertise for NGOs to apply to be funded by the department for various services. In this case, the services are bed spaces for persons with disabilities in residential care. And we then award funding or allocate funding to NGOs based on their applications and based on what we have available. Once that's done, then we continue funding them for 3 years, unless they close or unless they are not doing what they should be doing with the money or something like that, or unless their services become problematic and we need to shut them down or whatever. But generally, we continue funding them for that period. So what you're seeing there is the number of bed spaces that are funded for the year, and that amount will stay constant through the year, provided none of them close down. If they do close down, then the number would end up being reduced. But those NGOs that we fund for disabilities will be the same until we advertise for another round of applications. And when that happens, those NGOs apply, and some of them will come back again, continue to be funded, some of them might not. So it will depend. The last question from Honourable Member Barnes on the youth cafes. The last youth cafe that opened, if I'm not mistaken, was in Riversdale. And that one was the one that was due to open. I think that was the last one. Yeah, there might have been another one that reopened, that closed and reopened. I'm not sure. We did have to move one of them because the venue became a problem. So we've had to move. But in terms of a newly established youth cafe, Riversdale was the last site where we actually had a newly established one. And the Riversdale one was chosen because the municipality had a suitable venue, and there was a clear need in terms of the number of youth in the area that needed some kind of program because they're not in education, employment or training or school. And so basically the choice of sites for the youth cafes was always based around, firstly, an assessment of need in terms of young people, the number of young people in the area who were in need of those services, and then also based on whether there was a good venue that was able to be used, and then thirdly, based on whether there was an NGO in the area that could actually operate the place successfully. So those are the factors that we would use in terms of determining where to open the youth cafes. There's some areas where there's definitely a need, but we just can't find a building, or there's just no one who actually is willing to operate it. And so that will then make it impossible. And we have struggled sometimes with that, with youth cafes, if you open in the wrong venue and then no one comes, or the venue just isn't suitable and they can't do the programs they want to do. So yeah, thank you, Chair. That's the last one.
Thank you, HOD. Just before I go for follow-ups, I don't want to miss out on one or two key issues. The nearly 40,000 children in foster care is a lot. It's a dramatic high total, but as the HOD have indicated, sometimes you don't have a choice. If parents pass on and there's no family members to take care of the children, the department need to step in, and there might be other reasons as well. But fascinating for me also under your program 3, the reservations with regard to admitting girls between the ages, I think 14 and whatever. That for me is a grey area. And then you couple that maybe to some form of psychiatric disorder or something like that. I'm not so sure, but can you elaborate on that issue?
Which status was this? The CYCC secure care? Oh, with the behavioural challenges, yeah. Thank you, Chair. Yeah, our secure care centres, there's different types of child and youth care centres. We've got child and youth care centres that accommodate children who are orphans or vulnerable people, or children, and they've been either abandoned or neglected or parents have deceased.
Specifically focusing on the girls, why specifically the reservations on admittance of girls?
Okay. With child and youth care centres, we've got the secure care ones. So there's non-secure care ones and there's secure care ones, but they have to be divided between girls and boys because for obvious reasons. And we have a limited space for girls in our child and youth care centres at the moment because we only have one dedicated child and youth care centre for girls, which is Friedelus. I think so yeah, there's a bit of a challenge with that, but I think the question is about When you say reservations, Chair, I'm just trying to get to the part you're asking about.
Under program 3.
Issue is that they don't feel equipped to deal with teenage girls, NPO, CBCCs.
Yes, yeah, that's
That's a capacity problem in these zones.
Yeah, no, that's because as we mentioned, there's the NPOs that basically the NPOs do all the non-secure care placements of children. So children, the normal child and youth care centers, the non-secure ones are the orphanages, what we used to be called orphanages, and those are all run by NGOs. We don't run any of those ourselves. But some of those children start to behave or display challenging behavior in those facilities, particularly when they get into their teenage years, because if they've been abandoned and neglected, they often have trauma and things like that. So then they eventually end up sometimes needing to be placed into our secure care facilities because they can't cope with those children any longer. So then they have to be placed into our centers. But as I said, we've got quite limited space for girls, unfortunately. And that does mean then it can be difficult. It can be that they have to wait a while before we can get a placement for a girl into Friedlis. But those services usually involve therapeutic programs because our child and youth care, secure care centers, they have a multidisciplinary team that provides a combination of behavioral therapy as well as psychological service. We have a psychologist who's part of that team, and if necessary also works with health, with the psychiatric services if need be. But we are seeing, there's a lot of these children are starting to act out in their teens because they are quite traumatized. They've been abandoned or they've been subject to neglect and abuse when they were small. And then that starts manifesting in behavioral challenges when they hit their teenage years.
But why is that so evident amongst girls specifically, while you don't find, or do you find that same kind of behavior with boys as well?
We do, yes. The difference is it's just a bit more challenging with girls because we don't have as much space available. And that's what I was saying. We've got one facility for girls because generally we don't get as many girls placed as boys. I mean, if you look at the numbers, it's overwhelmingly boys that we need to place in the secure care environment. But there are some girls who do need to be placed. And that facility, Friedlis, is struggling with capacity. We're actually planning on moving it because it's also in the middle of a very violent section of
middle of Leonsdale, Elsie's River.
Yeah, so there's always bullets flying over the facility, and it's next to a field where gang fights are always happening. So we are planning on moving in the medium term to try and create also a bit of a bigger space as well.
I'm glad to hear that, looking at the safety of the personnel and the youngsters that is housed there. Honourable Vos and Honourable Windvogel. Okay. Honourable Windvogel, please.
Thank you, Chair.
Oh, sorry, you're not done yet. Sorry.
The last one. There is a lack of communication between welfare, the NPO entities that you are working with. They don't do the follow-ups in the program of foster care. I read that there is a case of 5 year hours in the 6th year that those families did not receive any foster money and the child is still with them. Now it is grade 11 since 2015. It's 8 years, actually 8 years. So can you do the follow-up on that, please? Because I don't want to lie, I see that there was a progress. Because after that, the family was called by this welfare. But after that, they never called again. They said they would come back to them they want to speak to the social workers in Kayamani that we're supposed to do all these things. But after that, they never get the actual not the us because it's my husband.
Okay, thank you, Honourable Member. Honourable Van Vogel.
Chair, the Minister mentioned something about the new program, Break the Silence. And she mentioned February, but she didn't say 2022, or was it now February 2023? So if we can just get clarity, because it's new for me as an alternative member of the Standing Committee. Then secondly, Chairperson, I just want to know the possibility in the Department of Health and Wellness, we do have this where members are also part of the hospital board committees. And I think, I'm not sure if it is the minister or the HOD that mentioned that you are taking it, the GBV and so on, to municipalities. Because sometimes you don't have the political will of municipalities to really run with this type of program. It's just there's no interest really. If you can adopt such a model like the Department of Health and Wellness, it's just something that I'm putting on your table to look in it and to see if it is possible. That you get the members who are deployed in those areas involved in such programs. Then lastly, Chair, I just need to know the drug shelters. It's falling under social development because I'm not sure how we are struggling in our community with drug addicts. Families are in danger of mothers and fathers because of these children that are becoming a danger to their parents. And most of the time I have to call or to send letters to yourself, the minister, to assist, especially in the community where I'm deployed. And there's no spaces for those people. They will be admitted at hospital, be there for a week or two, need to be discharged, because you remember they only have a certain period to stay there. And again, back in the hospital, out again. So it becomes really a problem. Are you thinking, because I know the minister mentioned that she wants a shelter for boys, but are you looking at, and the doctor also mentioned that there's new land available. Is there new drug shelters also part of that new developments? Thank you, Chairperson.
Thank you. No one else? Thank you, Doctor. You and your team.
Thank you very much, Chairperson. In terms of the question from Honourable Member Baku Vos on the view of DST in terms of expanding the victim empowerment program, including the budget, we did get some additional allocations that are proposed for the new financial year, which the committee will see, I think, in the coming weeks when the budget comes here. But so there is a bit of expansion coming within the constraints, of course, of what Treasury can assist us with. So we're looking at particularly expanding to more Tutuzela care centres, or helping to get more Tutuzela care centres open, so that there's greater access across the province. And then also additional shelter space in rural areas, as mentioned, as well as an expansion of some of the community-based models. We're looking at going into the safety hotspots with community-based GBV prevention programs in the coming year as well. So certainly we are expanding the project or the budget slightly, and so we will be expanding the programs that we are rolling out. But it's quite limited at the moment because obviously the Treasury is struggling to meet all the needs of different departments. So they've given us some funds, but it's not going to be enough to reach everywhere we'd like to reach. But it certainly will help if we get it as proposed in the upcoming budget. The question also about housing opportunities and subsidies for victims of GBV to help them become independent and not have to return to the perpetrator is something that we've been pushing for a long time under the special needs housing policy that's been developed nationally for human settlements. That policy is now being introduced. I think they've finished with it. So we are hoping that that's going to assist to a point. And certainly we've had a good relationship with with housing or human settlements rather, with referring people in need to them, particularly with disabilities and so on. But the provision for a step-down accommodation for victims of GBV is still very much one of the proposals that's contained in the implementation plan for GBV that we want to drive. And we are also working with NGOs that are setting up halfway houses or interim accommodation as well. So it's something that we support, and it's something that we will advocate for. And I think, you know, once we've got adequate spread of the first line services, that will be an area that we'll look at next. But I think at the moment the biggest demand is for just getting people to safety as a starting point. So, you know, the long-term support is still a work in progress. I think we don't have adequate spread of services in general yet. And that is still going to be the first port of call. In terms of the communication between the welfare NGOs and foster parents, I will certainly follow up on that case. I think if Honourable Member Baku Vos could send me the details of this situation. Is it Child Welfare Kraaifontein that's dealing with the matter? Is that what are they called now? They've changed their name. But I'll definitely follow up if you can give me the details through you, Chair. Then I'll be more than happy to follow up on that. That there's no reason why that should have happened, and unless the child for some reason is not actually in foster placement. But if there's a foster care order, then that order should have gone to SASSA, and then the grant should have been paid. So. You know that it doesn't make any sense if there is a foster order and the child's in foster care, why there is no foster grant. I'm not sure. Yes. Sure. Is that in Kayamandi? Is the child in Kayamandi? Okay, so that would be, yeah, we'll definitely follow up and find out what is going on there. But if there's a valid foster order in place, then it should be with SASSA, and there should be the foster grant. So yeah, so you know. Yeah, absolutely. No, I mean it makes no sense. And I mean, we are having cases at the moment where things are going wrong in the child protection system because between some of the NGOs are really struggling. They are sitting with lots of vacancies. They can't do what they need to do. Our people, our own officers are having to step in now to help with cases, but our own staff are now getting overloaded. And particularly some of the big child protection NGOs like Child Welfare, Badisa, and those organizations are really struggling at the moment. They're closing branches. We've had a number of branches that have closed down, and our staff have had to kind of step in as far as they can, but they're getting overloaded. So that is one of the reasons why we're adding extra posts now to try and take up the pressure that's coming. But these NGOs, we follow up where we have this problem, and if they can't function, then we have to stop funding them. We close that down and we take over. So, but please send me that because then I can follow that up and find out what happened. And then Honourable Member Van Vogel asked about the Break the Cycle campaign. That has just been released about 3 weeks ago. It's a campaign that the Department of the Premier's media department, their communications department, funded and delivered. And it's gone live on the Western Cape Government website, so it's accessible on the Western Cape Government's site. But it's a Break the Cycle campaign video and information portal. So there's also the details of the GBV command center and other things that are provided on there for people who want to access assistance. It's called Break the Cycle. That's the name of the campaign. In terms of the question about the municipal buy-in for GBV work and the model of the Department of Health in terms of hospital board members, I'll certainly discuss that with the Department of Health to find out more about what they're doing. But that model is a legislated model. So for GBV type of services, it would perhaps require some kind of legislative provision, like there is for local drug action committees. And I must say the municipalities were not very happy about being mandated to do that because they felt social services are not, or social welfare is not their mandate. But since that time, there's been quite a few municipalities that have come on board. But as I say, we are finding municipalities are quite supportive of the GBV work, and we've got Salga on board as well with that, and they're also very supportive. So we will look at that model and see if there's something we can do that's similar. And then lastly, the question around expansion of drug treatment programs. At the moment, we are maintaining our existing capacity for drug treatment. We got no means to expand at the moment. There's no extra money at all for drug treatment programs, but the expansion of our child and youth care centres is going to create more space for children and youth to come and get drug treatment in the child and youth care centres. So that will at least provide some assistance for children who are out of control, who need to be placed into secure care and can access treatment programs in there. But I expect that the honourable member's reference to there not being spaces in drug treatment is probably for minors and not adults. I'm not sure, but with adults generally we are able to find spaces because we often find a lot of our treatment programs are underused at times. The only thing is that you have to wait for the treatment cycle. So sometimes the treatment cycle starts with a group and they do group work, and then you have to wait until the next group starts. So sometimes there's a need to say, okay, well, the next group is starting in a month's time, so we can admit the person then because they can't come in the middle of the program. But in terms of treatment programs for adults, there are spaces available in residential programs a lot of the time, but they may not be in the area the person's living, so they may have to go to a different area. That's the only challenge that we sometimes run into. But where we're really facing a problem with spaces in treatment is for under 18s, because there is not enough there. So that's that's our biggest challenge at the moment, is having enough treatment opportunities for under 18s. But if there are people, where there are adults who need to go in for treatment, we can usually find a space for them. The only thing also is if they are court ordered to go into a program, there's only some programs that will take those people. And then it can be a little bit difficult. But if people are going willingly, we can usually find a space, because there's a lot of NGOs that provide treatment, especially outside of the metro. There's treatment programs we can send people to. So if a local treatment centre doesn't have space and the person really needs to be admitted, they can sometimes be sent to somewhere like Toevlug in Worcester, or Hesketh King in the Winelands, or somewhere like that as well. So if there's not a local space, they shouldn't give up. They must just ask the social worker to check if there's other places a little bit further away that they can go to, because usually those places do have space available then. And if it's residential care, they stay there. So it can work. But thank you.
Yeah, thank you, Dr. MacDonald. Look, one can continue and asking questions and ask more and more questions. It's quite a comprehensive document, this presentation. I'm very glad with the fact that you also give not really negatives, but also what is not so good in the department, the issue with regard to the achievements, partially achieved and non-achieved and that sort of thing, that one is aware, but we also understand the budgetary issues, budgetary cuts, and then also what you have mentioned, the increasing population of the Western Cape, all of those issues impact on services, and if the budget stays the same, what can you do? That's always a challenge, and one needs to admit that and note that. But also that with regard to the children's issue, unification of children with the families, and that is so important. The fact that you try your best in that regard, but also GBV for people, more and more people coming forward. I think the minister mentioned that. I'm not sure. I think she have said people coming forward at an ever-increasing rate, and I think that is important. Just that statement. So it says to me that something positive is happening with regard to the projects and the programs and so on. Substance abuse, we talked about it a minute ago. The use of the aftercare services, that is another highlight. It means people are coming forward to make use of the aftercare services. We need to note that as well. And then another positive is youth involved in skill development programs. It's a highlight for me to hear that one as well. The downside, there's not much you can do about it as a department. We can just do that much. The socio-economical conditions we find ourselves in the whole country. It's evident to the Western Cape as well, and the Western Cape is no exception. The government as a whole, and that is where the whole of society approach is coming in, as a whole, government will have to deal with that. We need more job creation opportunities to deal with unemployment, to deal with poverty. And if you see how many people standing in the queues for the 350 rand grant, says to me that 350 rand for us might be nothing. But for them, they live on it for days. They stretch that 5 rand and that 10 rand for the whole family to eat. So we're facing challenges. We need to admit, we need to rally around, and that is why I've said I'm part of the Health Standing Committee as well, and I said it, I think it was last week, myself and some of the members sitting here, is health talking to social development, is social development talking to health, the whole of society approach to deal with these issues as government as a whole. But on that note, let me say to the HOD, thank you and your team, the two ladies, for being here today, answering the questions to the best of your abilities. And for the members, thank you for your presence as well. Council Member Fry, not well, but he's here, and we appreciate that. He just said this morning, he's also on his way to his doctor for a quick checkup and that sort of thing, and for some medication. The meeting is adjourned, and the officials might leave, but the honourable members must just stay for another couple of minutes. Thank you.
Thank you very much, Chairperson and honourable members. If I could just request that info be sent about that child that hasn't had the grant.
Thank you.
I'd be happy to follow up as soon as possible. Thank you, Chair.
Enjoy your day. Bye-bye. We're going to do now with the committee program.
Yeah.
Also, honourable members, I don't want to keep you any minute longer. On the agenda for today, consideration and adoption of the committee program. Lamonde, can you deal with that one quickly?
Okay, I'm going to just flag the program. Okay. Here, the program on the screen. Yeah. Members have copies of it.
Yeah, all the members have copies of it. Are you okay with the program as it stands?
Okay. We are here now on the 28th. The next meeting is on the 17th.
No problem. That's it, I think.
The committee program member.
Done. On this page, the back and the front printed. The one lying there. I can see it there in front of you.
Okay,
that's
so,
it.
Okay.
No Monday.
It's on the screen, members. Today is the 28th. We have a meeting today. Then the next meeting is going to be on the 17th of March, which is the deliberations on Vote 7, the budget. Then the 23rd, we're supposed to have to finalize the committee report on the budget. Then we'll have a briefing again on the 11th of April. This briefing, remember we had the briefing on the 6th of September last year, but it was just a rush meeting then. So we are going to reschedule the meeting. And after that, after the ICRA briefing, we'll have a briefing again by the Department of Social Development on the funding of old age homes in the province. And then the 9th of May is the briefing by Child Welfare on their footprint, capacity and funding allocation by the Department of Social Development. In May, we have the briefing by NGOs on issues facing children. I think we'll have to invite the Children's Commission on this one. Then there's that joint visit to NGOs to Toes River, to Mauriceburg, Beaufort West Oudtshoorn, and that now is scheduled for June.
No problem.
It was supposed to be here on the Easters, but I think because there is not enough time.
Yeah.
I don't know. So now it's back to June, members. When in June?
I've got no problem with that. You may.
No more.
No, Maris. Is it Maris?
No, I got it like this.
No, it's fine. I wanted to. No, man, we changed it to Mauriceburg, and Mauriceburg is too far. I thought so. Buns will look at member Buns. Ek het geweet as ek daai comment maak.
Want it to be announced or unannounced in the land?
Yeah. But sometimes with the what I pick up was sometimes with the unannounced, then the manager and those people are not there all the time. Then we miss out. Then we must talk to junior officials, and we want to talk to the top. We just need to bear that in mind.
Is it in the land place of safety?
Yeah. You got that? Okay, thank you. Guys?
Just clarity, Chair, with the briefing by Children's Organization, is the Children's Commissioner also
Yeah,
part
I
of
think
that?
that is what
Okay.
we said.
Yes, she will attend the meeting.
Okay, guys, honourable members, you're happy with the program as it stands for now? Okay, with the additions, no problem. Honourable member, you may.
I'm going to keep it very short because I know we want to go. I'm new to all of this. I don't know how the program works. In future, or I don't know if you've done it before, can the oversight include visits to some of the organizations that deals with youth who are taken from gang-infested communities, and also oversight visits to the facilities where the homeless are taken to see the conditions and also the programs that are being done there?
We normally do that as well, yes, as far as possible.
Okay, so we will be having it throughout the year again. Okay.
If she's got a specific places, she can
Yeah,
forward
look,
the name.
honourable member, if you do have, like with what Honourable Baku Vos have done, if you have a specific place, facility, you feel it's appropriate for us to visit, bring it under the attention of Nomonde. Yeah. Okay, that is then Honourable Baku.
Yeah.
Yes, we Yeah, thank you so much. No. Okay, any resolutions from your side?
Because what I learned in Travis and Lady Smith, it was Soa or Lady Smith, municipalities that does not use their funding to empower the NPOs to social.
They use the funding for something else within the system.
So is the detailed report on the GP?
Yeah, on the, what we want to know the programs that they implemented in the province in the previous 12 months and how much each department and municipality spend on GP.
Yeah. Honourable Bunce?
Mine will be on the two questions that I've raised earlier, where I was asking on the amounts that are constantly the same of the targets. The targets are always the same. So what I wanted to ask was more if we could get a report on demographics, on which NPOs in which areas are funded, like for each region. Names and details of the NPOs, how much they get, if we can get that. And then for old age homes, persons with disabilities, I think it was on program 3 somewhere on the presentation. Yeah. And then my second one was on the last question that I asked on youth cafes. If we can also get a comprehensive report on the youth cafes, like the funding models, how they are funded, and the details of funders, etc. And then the granular participation of youth, a report on how youth is participating. And maybe perhaps lastly, if we can get the department also to come and give us an intense report on these youth centers, how they are addressing the social ills, and how many have been implemented, and what is the plan moving forward on how many they still target to bring into the province. I have so much interest into the youth centers. Thank you very much, Chair.
Any more recommendations, Honourable?
taking into consideration to be with the facilities, but the recent engines, how many do we have? So we can get that information.
Thank you. Okay. Is that it, Honourable Fry? Nothing from your side? Okay. Honourable members, I think that is it with regard to recommendations.
Yeah, the last one, sorry, Chair.
No problem.
Yeah, social workers. I really want to understand if it is possible, can they give us a report in terms of social workers also in the Western Cape, in the different regions? If we can get numbers, specific numbers. Thanks, Chair.
It's not a recommendation, but in link up to your question about social workers. The doctor did indicate the shortage of social workers, but I get calls from time to time, social workers phoning. Aren't there employment opportunities and that sort of thing? There's a number of social workers unemployed in Cape Town and the Western Cape. And but I should have asked the question. It's fine. I will in my own time deal with that with Dr. McDonald. That is then the issue with regard to recommendations. There's one last issue I need to bring under your attention. I think you've seen it on the part of the agenda item today, point number 11. The Fundraising Amendment Bill B29B of 2020 NCOP proposed section 76(1) bill was referred to the Standing Committee on Social Development via an ATC on Friday, 24th February 2023. The committee is still waiting for the documentation to start with the process of consideration of the bill. So I confirm it with Nomonde. She said the documentation did not arrive as yet, but it's just for us to note that we were notified by the NCOP about this bill. The committee will have to prioritize the bill in the committee program. So it's extra work for us, but part of our work. The bill will follow a similar process as the Children's Amendment Bill, which the committee dealt with in September and October last year. The committee will have to invite the National Department to brief the committee on this bill the moment we receive the documentation. Then, after briefing, decide on this, and this is it, another public participation process will have to follow. Then, after public inputs, decide on the position of the province on the bill. That is the normal official administrative processes the bill needs to run. It needs to run its course. Just that you are officially aware of it. And I think on that note, I want to call the meeting a day. We're done. And the meeting is then adjourned, and you may go home or whatever you're going to do to your office and to your constituency. Thank you so much for being part of this meeting.
Thank you, Chair.